Number one, comprehensive preparedness and response. One of the main strengths of the Ministry of Health MOH in managing COVID-19 was its comprehensive preparedness and response. MOH followed all the key strategies from the WHO's preparedness plan, including surveillance, communication, and healthcare services. Secondly, early government action helped Malaysia respond quickly before the virus spread widely. This allowed better control and readiness. Number two, equity of access. Another strength is equity of access. The government provided COVID-19 testing and treatment for everyone, including foreigners and non citizens, showing a fair and inclusive healthcare approach. The first weakness is healthcare system strength. During the peak of the pandemic, Malaysia's healthcare system faced heavy pressure. Hospitals were overcrowded and there was a shortage of ICU beds, medical equipment, and healthcare workers. Frontliners had to work long hours under extreme stress. For example, some hospitals in Kelang Valley were operating over their full capacity, which affected the quality of care given to COVID-19 and non COVID patients. This showed that the system was not fully prepared for a health crisis of such scale. Number two is dependency of law enforcement. Malaysia relied heavily on police and military forces to enforce SOP and lockdown rules. While this helped with compliance, it also raised concerns about fear-based control rather than building public trust and understanding. Some people were more afraid of getting fined than understanding the health risks, which affected long-term public cooperation.
So for the opportunity part, we have two, which is the first one is strengthening of public and private collaboration, workforce support and mobilization. The private sector provides essential workforce support, including specialists, medical officers, and nurses, to assist public health teams. The pandemic also highlighted the need for flexible reallocation of healthcare workers and the involvement of external groups like the military and volunteers. The second one is enhancement of healthcare infrastructure and logistics, expanded hospital and testing capacity. The MOH increased the capacity for diagnostic and treatment by increasing the number of hospitals designated for COVID-19 cases, expanding laboratory capacity, and increasing the number of available critical care beds and ventilators. Okay, so for the threat that MOH faced during the COVID-19 pandemic is first, resource and infrastructure shortage. Strength capacity. The high number of COVID-19 cases placed unprecedented pressure on the existing healthcare structure, leading to an ICU management crisis and high hospital bed occupancy rate. Second one is public and social behavior. SOP violation and non-compliance. A major challenge was the public not adhering strictly to control measures such as physical distancing, wearing masks, and avoiding mass gathering. Notably, a surge in cases occurred in September 2020 due to mass gathering and SOP breaches. During a state election, even after fines were introduced, non-compliance remained. So that's all for me. Thank you.
Next, I will talk about how to manage the issues discussed, which is vaccination program. The COVID-19 vaccination program in Malaysia was introduced when the government realized that the virus could not be controlled by movement restriction alone. After studying global research and observing how other countries use vaccine to reduce infections, Malaysia decided that vaccination was the best long-term solution. The Ministry of Health MOH together with National experts reviewed scientific data to ensure that the vaccine were safe and effective. Once the vaccines were approved, the government launched the National COVID-19 Immunization Program, PIC, in February 2021. The main idea behind the program was to protect the people, reduce severe cases, and eventually allow the country to reopen safely. To carry out vaccination program, the government planned it in several phases. The first phase focused on protecting frontliners, such as doctors, nurses, police, and military officers who face the highest risks. The second phase targets senior citizens, people with chronic illnesses, and individuals with disabilities. The third phase was for the general adult population. Later, the program expanded to include teenagers and young children. Vaccination centers (PPVs) were set up in hospitals, stadiums, schools, community halls, and even drive-through locations. The MySejahtera app was used for registration, appointment scheduling, and vaccination status updates. Thousands of healthcare workers and volunteers worked together to ensure the process ran smoothly and quickly. The vaccination program proved to be highly effective for Malaysia. As more people received their doses, the number of severe cases and deaths began to drop significantly. This helped reduce the pressure on hospitals, allowing the healthcare system to recover and operate more safely. Vaccination also supported the reopening of schools, businesses, and interstate travel, which helped the economy bounce back. Although some people were initially hesitant, widespread vaccination helped build community protection or herd immunity, which slowed the spread of the virus. Overall, the program played a crucial role in saving lives and helping the country move toward normalcy.
The second way to manage the issue is by the Movement Control Order (PKP). The Movement Control Order (PKP) in Malaysia began when the Ministry of Health (MOH) noticed a sudden change and dangerous rise of COVID-19 cases, especially after the Sri Petaling cluster. MOH collected data every day, studied how fast the virus was spreading, and realized that normal precautions were not enough to control the outbreak. They reported their findings to the National Security Council and recommended strong nationwide action. Based on MOH advice, the government introduced the first PKP on 18 March 2020. The main goal was to slow down the infection rate and prevent hospitals from becoming overwhelmed. When PKP was carried out, Malaysia through a strict period where people were not allowed to leave their home except for essential needs like buying food or getting medical care. Schools, officer, and non-essential business were closed, while other healthcare, food supply, and other important services continued to operate. The police and military set up roadblocks to control movement between district and state. Borders were also closed to limit imported case. Meanwhile, MOH continued testing, tracing contact, and isolating positive cases to break the chain of infection. Daily press conferences keep the public updated and help people understand the importance of following the rules. Overall, PKP was effective for Malaysia, especially during the early stage in pandemic. It successfully reduced the number of daily cases and prevented the healthcare system from collapsing.